Good evening, everybody. I trust you are all well. My name is Dr. Essa Zanambasi of Simply Healthier. That is my brand. And today we are going to talk about thrombophlebitis. And I've started by defining what it is. A thrombus is a clot. Phlebitis is inflammation inside veins. So you all are welcome, and I hope there are many, many guests here. You are all welcome. Right, thrombophlebitis, that is inflammation within the veins leading to clot formation, can be either superficial or deep. It is quite common. Superficial thrombophlebitis is common, and it is recognized by the veins feeling quite hard on the surface, and they might appear darker or red and are painful. And that can spread into the surrounding lymphatic tissue and lymphatics, and it can be caused by things like trauma or an injection following an IV intravenous administration of that injection. Standing for a long time, and therefore lack of exercise, especially occupations and professions that stand on their feet for ages. You can think of many. And then smoking and obesity. So you can see already that what we do in our lives, our lifestyle can influence development of thrombophlebitis. So this is a picture to show superficial and deep, which I'm going to discuss next. But yeah, superficial, it is deep inside the muscle, and deep thrombophlebitis, we often refer to as deep vein thrombosis. It affects those veins either in between muscles or even into the muscles themselves. And those veins tend to be quite large, particularly in the lower limbs, but it can also affect the upper limbs as well. And what causes this to be particularly serious is that these veins carry a large volume of blood back into the heart, back to the heart. So you can imagine they have an important job of carrying blood from the feet and the calves and the thighs, all the way back into the heart. It has to go back, obviously, so that it can be recirculated and oxygenated as well. So now the risk is that if there is chronically reduced blood flow, this will cause other conditions such as dermatitis or even ulceration of the feet and around the calf and the ankle, what we know as a venous ulcer. And I'm sure we have from time to time been asked that question, how do we treat that ulcer? Well, I hope this presentation will go some way into answering that question. And like all things about our health and our bodies, there is no single answer to any question. And there is no single factor leading to conditions that we see commonly. So I've often said that we need to get to know the person before we become fascinated by the condition, because that goes a long way to finding the solutions. Okay, so varicose veins, what are those? Veins have valves, and it is important, unlike the muscle, the arteries, which are quite muscular, veins are less muscular, they're thinner, and so depend on valves to help the blood to not flow backwards. Now, valves in those veins can become damaged, which will therefore lead to accumulation of blood, and that blood will stand around, it will be static, and it will have low oxygen, as is venous blood. It doesn't have much oxygen left in it. And also the nutrients are low, and the limb so affected becomes inflamed, manifesting as pain, and it has a strong potential for infection. So the significance of that is that when a clot forms, which it often does, it can then break off, as we will see the consequences of that. So this leads to formation of deadly clots that we call thromboemboli, and they're deadly in that they cause challenges. Now, why is it important to maintain our muscles? All of you will remember that we once had a webinar on sarcopenia, which is age-related muscle loss. It doesn't have to happen rapidly, but we do see that it happens a lot. You look around and you see that as people grow older, they tend to lose their muscle mass. And with it goes the important muscle pump mechanism. It also gets lost. And it is important to maintain that mechanism because it works efficiently with pushing blood back to the heart in the veins. Okay, so I hope that one is clear. So let's look at it in a picture like that, where the veins have valves. These are the valves, and blood flows nicely. So you can imagine the foot is down here, and muscles in the leg are what pump the blood back up. So as we paint the picture, what would varicose veins be due to, and what leads to damage of valves is the key question now. And on top of the list is constipation. Oh no. And then increased intra-abdominal pressure, such as during pregnancy. And I think that is why we see these problems more often in women. And then lack of exercise, because exercise is how the muscle pump mechanism works. And then poor muscle tone. I've just mentioned sarcopenia, but even in younger people, if they are not regularly toning their muscles and nourishing them, then they will be a challenge. And then nutritional deficiencies, such as vitamin B1, also known as thiamine deficiency, and vitamin D deficiency, both of which are very, very common. We've discussed this throughout, but we need to reiterate it in this particular presentation. And then, of course, there was a disease, or there is a disease that is known as beriberi. It is specifically due to vitamin B1 deficiency. It is very common in people who use a lot of alcohol in their diet, alcoholics, or even if they're not necessarily alcoholic, but they use a lot of alcohol. And it is also associated with heart failure. Heart failure is the heart is a muscle, and it needs to be nourished a lot. So what caused beriberi to become prevalent was the polishing of grain. Yes, when we started polishing our grains and having all those processed foods, beriberi also shot up in prevalence. Now, just a picture of thrombophlebitis. And this is what I was talking about, dermatitis. And so there are some 8 early warning signs of a blood clot that you shouldn't ignore. They should always be taken seriously, such as swelling of one limb and pain and tenderness or cramps in the limbs, or red or dark streaks along veins. Chest pain and heavy breathing might mean that clots have been disseminated. Shortness of breath, unexplained cough, vomiting or diarrhea might mean that the gut circulation has been affected by those clots. And then, of course, chronic headaches might mean that now the blood supply to the brain and the head has been compromised. So I was asking myself, how does all this begin in the first place? Well, minor injuries that happen repeatedly within the blood vessels can lead to the body's attempt to repair. So the body will set up a repair process whereby platelets, those are the clotting cells in our blood circulation, will collect at that area, or those areas if there are many, multiple, and then the clot forms by a circulating protein called fibrinogen. We also call it clotting factor 1. There are a few clotting factors, but that is the first clotting factor. It's soluble in blood, but then when it finds a place where it needs to do some repair work, as in form a clot, it will come there and it will be transformed into fibrin, which is insoluble. It forms like a net, which then traps blood cells and plasma and all those things within the blood to form a clot. Now, picture this: if there's repeated trauma within the cells, within the veins, this will need to make sure that we are well nourished so that it doesn't happen. So symptoms and signs very, very quickly. Pain, which is worse on walking. It tends to ease off with rest and elevation of the limb, which will then make the person resist or be reluctant to walk. And then there's swelling, warmth, dark discoloration, as we've seen in that picture. And they might even be fevers or chills. One has to know that it might be a different condition altogether, such as cellulitis, which is often mistaken for this. But we still have to have a very high index of suspicion, especially because the symptoms may be taken lightly and somebody will say, this isn't important, when in fact it is thrombophlebitis. Let us hope that it isn't thrombophlebitis and it is just cellulitis or something less like an insect bite, but we still have to have a very high index of suspicion. Then also, when you're talking to your friends, family, clients, remember to build a relationship and ask questions about risk factors that might lead to this. Do you exercise? Or were you recently pregnant? Or have you had surgery lately? Or even trauma? And perhaps if they're females, which they often are you on the oral contraceptive pill, perhaps? And if somebody has been ill for some time and has been bedridden for some time, they are more likely to develop this complication. So we need to be in a position to ask our friends and family so that you can recommend what we are about to discuss nutritionally. Now, our biggest concern and perhaps the biggest threat is when a thrombus, also known as a clot, breaks off and travels in the bloodstream and then lodges somewhere and cuts off blood supply to various organs. And so all those organs over there can be affected by a clot lodging in the artery that supplies blood to it. And then the other factor that we have to remember is that they might be as a result of abnormal clotting tendencies, the tendency to form clots, because perhaps they are deficiencies of the factors required or abnormalities in the factors. So there are some conditions that are common as a result of abnormalities in the coagulation factors. and we see them from time to time. But then there are also deficiencies of nutrients such as calcium, phospholipids. Now, this is actually very exciting because that's where we have the leading product that I will show you when we get to the products. Okay, so those are among the factors that influence clot formation, but also if the liver is not working very well, yeah, then, or if there is a deficiency in vitamin K as a result of the liver not working very well and other factors, then they will be in inability to produce the coagulation factors. They are in fact produced by the liver, and those are protein factors. And our bodies make over 5,000 different proteins, and we need all the 22 amino acids. Let me not jump to that yet, but that is something that I want you to think through and think about, and perhaps begin to understand why Neolife gives us what they give us. Then vitamin K, just as a note, is from plant and animal sources in our diet. But it is important to remember that vitamin K is also made by our gut bacteria. I put it here almost in block letters because if you are doing things to disrupt your gut bacteria, like taking too many antibiotics or all sorts of things that will kill those bacteria, then unfortunately you run the risk of developing the issue of clotting. Okay, and that is something that we can educate ourselves and our clients on. So I want you to think on this. Okay, I just thought to myself, oh my gosh, we have so much we need to become conscious of, become aware of, and become really, really intentional about. Okay, point number one, straining when passing stool causes an increase in the pressure of the rectal and anal veins by 2 to 4 times the normal pressure. And that in itself can be damaging to the veins in that part of our body. This will lead to weakening blood vessels, yes? And then those weakened blood vessels will lead to damaged valves. And that will cause aggravation of the hemorrhoids, also known as piles, leading to phlebitis, that is inflammation in the veins, and thereby causing a place or a nidus of thrombus formation, clot formation. So can you see, I'm connecting a few dots here, and we have on several occasions discussed constipation and the importance not to have constipation. And I'm speaking like this because I do know for a fact that it is a major problem. It is a major problem. So we need to make sure that we address it and address it well. Okay, cardiovascular disease. And that is what we are talking about when we talk about the dangers of blood clotting and blood vessels. We've talked about the heart several times, but cardiovascular disease, it is the leading health problem worldwide. Millions of people are afflicted by it. Many do not even classify whatever it is that they are feeling as a disease that can be put in this category as cardiovascular disease. Some of them might not have any symptoms, for example. And then I've just outlined how it is quite possible for a stroke to happen when a clot breaks off and travels and blocks some part of the body. If it happens to be in the brain, then stroke is a common presentation of cardiovascular disease. And all of us have been increasingly alarmed at how common it is. So please note all associated with environmental sensitivities and allergies. That is something that we should never forget as a family. So now let's talk about our diets. Yeah. We are advised to eat plenty of fruits and vegetables and do all the right things. Make sure we avoid junk food, the so-called junk food. Make sure that we are generally looking after our health before we quickly assume that we are lacking some medication. It might be so. I'm not discouraging us from using it, but we want to be preventative all the time. Now, the food that we are eating today would be sufficient if we were way back in the 50s and 60s before the soils were depleted of nutrients. So that is why this group of scientists have come up and said that we need to supplement, and they have given us food-based, not only just food-based, but whole food, non-GMO based supplements that we have in this family and company. So why we need to supplement? I've mentioned the importance of vitamin B. I talked about thiamine specifically, but in your life, you get everything as a family. Somebody is writing on my screen. I don't know why you do that. Anyway, then there is sarcopenia that we've talked about. In order to keep your muscles working well, you need to make sure that you're nourishing them. And that's why I've shown these 22 amino acid formulations, which are whole meal supplements, and we need them to build our muscles. Okay, let's see if we can share again. All right. Then our advice is always to start with core nutrition before you add targeted solutions. That is a good principle to stand by, and this series for several weeks has focused on just that principle. Start with core nutrition, which are foundation products. I've shown you the shake, which is a foundation product, and then add targeted solutions, for example, the vitamin B. But here is the other part of the core nutrition, which we call pro-vitality. It will give you the phospholipids in threonine. It also gives you omega-3 range of vitamins and minerals. So it will supply the foundation. We are happy with that. But let's add some targeted solutions. Okay, let me just go through this. That is a summary of the core nutrition, where you get the threonine, you get the antioxidants, the fruits and vegetables. You also get the proven cardiovascular protection from our amino acids formulations. And then, of course, you reduce inflammation. We've talked about phlebitis. Every time you hear itis, wherever it might be, dermatitis as a result of phlebitis, that is an indication that there's some bad inflammation going on. So, first product that I really want to emphasize, and it is amazing that they singled out our need for the coagulation factors, which are protein in nature, which are a combination of proteins and minerals and all the other things, phospholipids and calcium. So here is where you will get the phospholipids, and then the calcium and magnesium. And this, our formulation has vitamin D as well. And then you need to avoid constipation. So we have some suggestions here. And taking aloe vera regularly is the very reason that we all must build our businesses nice and strong so that we can afford not only aloe vera, but all these products as part of our diet. And then we need to remember this range of products. Should you need to use a gentle laxative that is not chemical, but in fact is herbal, and it also cleanses out the lymphatic system, stage 6 is amazing. And as I pointed out earlier, phlebitis can spread and affect the lymphatic system, which means that they need to also be cleansed out from time to time. So here again is a very good reason for a regular detox. Then I talked about maintaining the muscle pump mechanism. So important. And vitamin D and either vegan D or A and D are important for that purpose, because the older we grow, unfortunately, the more likely we will develop sarcopenia, which is loss of muscle mass, and thereby loss of our pump mechanism of the muscle, and that affects return of venous blood to the heart, towards the heart. So I hope you're connecting the dots with me. As I was doing this presentation, I was actually marveling at how we are created almost to the last detail. And it is our responsibility to make sure that we look after our bodies. Then crucial for healthy blood vessels, vitamin C, because it builds the collagen, but it does much more than that. It nourishes every part. It's a powerful antioxidant. It nourishes the adrenal glands, and thereby the adrenal glands, which are healthy, will keep us healthy as well, and maintain our blood pressures so that we don't develop hectic reasons for cardiovascular disease. They work together, flavonoids. Very often when we are talking about what to advise somebody with varicose veins, flavonoid complex comes up, as does multi-mineral. But judging from this presentation, there is no single product that you can say, just use this one. You need to be as holistic as possible. And then to keep the blood flowing, garlic is excellent for that. I've already shown it in the detox, but here it is again. Vitamin E as well. Vitamin E is important for oxygenation of the blood and to keep it flowing, and also to help the red blood cells to release oxygen into the tissues. Okay. Then I'd like to remind us all that prevention is always, always, always better than cure. So cardiovascular disease, and therefore the damage to the veins, and therefore development of blood clots and thrombophlebitis, is not an inevitable result of aging. So let us not despair and say, after all, so and so is old. I think that's not a very fair statement, because we can reverse a lot of the damage or prevent it. So prevention is better than cure. Encourage everybody. Anyway, most people are not smoking much these days. They've realized that it is an outdated practice. However, we like to say that sitting is the new smoking, which means that people are not exercising adequately if they're sitting around all day. So a sedentary lifestyle is one of the predisposing factors. Stress can lead to a tendency to clot. Then of course the dietary habits, and then obesity is another one. And then diabetes is something that we need to always be aware of and encourage ourselves to control. So we do nothing. We need to feed our children well. New Life has a children's program. Let us start the children right. And when they grow up, they won't have these challenges. And then we need also to look after our environments. And that's why we have cleaning products that are low burden, non-toxic, eco-friendly. And I'm just wanting to remind the visitors and the guests that your health literally depends on the washing powder you use. And if you're new to this platform, you'll say, what? Are they crazy? No, we are not. We are perfectly sane. And I mean what I'm saying. And so with ours, which is economical, eco-friendly, very efficient, and so effective, you'll be amazed at how excellent it is for all your washing, both machine and hand. And then, of course, once you lower the toxins and the irritation and the bad type of inflammation by the choices that you make, even for your skin and your hair and everything, you will go a long way to avoiding that challenge of clotting. So if you're new, and if you're not so new either, you are most welcome to see how your health can be viewed with a long-range vision. That's what this particular family is an expert in. You can run your own business, your own nutrition and skin and cleaning business when you join the family. And we encourage as many people as possible to keep sharing what we've got. Yeah, so thank you. And I will stop the recording.